Thank you again, everybody, for attending the League of Women Voters ODC's Happy Hour and Hot Topics. Tonight's presenter is Jillian Riley. Her pronouns are she and her. She is the director, the North Carolina Director of Public Affairs and Lobbyist for Planned Parenthood South Atlantic. Jillian has a master's degree in social work and community management and policy practice from UNC Chapel Hill. She has worked across the state for many years as a grassroots organizer and policy advocate. Thank you, Jillian, for joining us and your presentation tonight, Post Road Roadmap. Where do we go from here?
Well, thank you, Amy, and thank you all so much for having me tonight. I'm happy to be here. It has been a wild ride since the Dobbs case was first heard and since Roe was overturned. So let me go ahead and just share my screen really quickly. Hold on really quick. Let me do this differently. There we go. So I'm Jillian Riley, the North Carolina Director of Public Affairs. And I want to just first start us out talking about the Dobbs case. So Dobbs v. Jackson Women's Health Organization. The Jackson Women's Health Organization was the only abortion provider in the state of Mississippi for over a decade. So the state legislature in Mississippi passed a 15-week ban, and it went all the way up to the U.S. Supreme Court. The state of Mississippi directly asked the court to overturn Roe v. Wade, and the court did rule to overturn and allow state legislatures to have the power to control abortion regulations. And what we've seen since then is that these states in orange have in some way introduced new legislation to ban or highly restrict abortion. Or they had what was called a trigger law or a trigger ban, which was a ban that was on the books that was ready to put in place an abortion ban as soon as Roe was overturned, which really just goes to show how planned out it was, the overturn of Roe. It was part of the plan, and state legislatures working nationally to ensure that their state would ban abortion as soon as that plan went into effect. So this map, you can see North Carolina and Virginia are really the two states in the South. Specifically, North Carolina is really the state in the Southeast with all of those states underneath us that are really depending on us. So Florida, South Carolina, Alabama, Tennessee, Georgia, Louisiana, Texas, we see people from all of these states coming to us for abortions. And we really are a critical access point for abortion, for an abortion service in the Southeast. But we also know that that's hanging on by a thread, right? Given the election and what could happen in November. It's also important to take note that abortions are not easily accessible in North Carolina. So there are 14 clinics total. That includes both Planned Parenthood clinics and independent providers, most of which are in urban areas. So 92% of North Carolina counties do not have an abortion provider. So people in the state of North Carolina are already having to travel across county lines to be able to receive an abortion. And that's, even more devastating when we think about the people that are having to travel across multiple states. We've seen people driving from Texas to Charlotte overnight in order to make an appointment. And so the amount of barriers that are in place for people right now is unprecedented, and it's outrageous when we think about just how this impacts people and their ability to make decisions about their body and their health. So other things we have on the books that are really important to understand. We have a ban on medication abortion, the abortion pill. So we have 9 Planned Parenthood health centers. Only 6 of our centers actually provide abortion services. And that's surgical abortion and medication abortion. But all 9 of our centers should be allowed to provide abortions if the medication abortion was allowed to be provided at those health centers. But because there are so many targeted regulations on centers that provide abortions, we're not even allowed to prescribe a pill, prescription, medication abortion at our other facilities. Additionally, we cannot provide them via telehealth. And so our patients have to come in order to get the abortion medication pill. And this is something telehealth, abortion pills via telehealth are happening all across the US right now. They're happening in Virginia. They've been approved by the FDA to prescribe them this way, but we're having to, our patients have to come inside to the clinic. And so when we think about patients traveling across state lines where maybe there's a 6-week ban in Texas, they're at 7 weeks, and they're coming to us because they don't know where else to go, or maybe the swath of where they would want to go also doesn't allow it via telehealth, so they have to come to North Carolina to get the pill. So we're seeing people having to travel even across state lines just to get medication abortion. We also have a 72-hour mandatory delay. This is one of the longest in the countries. So what this means is when you first call to make your appointment, we start the clock of that 72 hours. So we might have an appointment available that day for an abortion, but people aren't allowed to come to that appointment. They have to come at least 72 hours later. But we don't provide abortions every day. And we have an influx of people right now. So our next available appointment might not actually be till 2 weeks or 10 days. So this delay is really triggering to our clients and our patients. It really impacts them. I was just talking with one of our abortion providers a couple of days ago, and I asked him, I was like, how have you seen this delay really impact our patients? Because it's 72 hours. It used to be 24 hours, and it used to be non-existent. So there really is no medical reason for this. And it's a way that politicians have said that women don't know what they're doing with their bodies. They need time to think. They will receive bias counseling requirements written by the state during this time. So I asked our provider, and I said, how has this really impacted our patients? And he says, oh, it messes them up. It messes them up. He says maybe 1 out of 100 patients needs that extra time to think about it. But at Planned Parenthood, we always talk with our patients about their medical decisions and health decisions. And we want everyone to feel confident in their healthcare system and to be a part of their health plan, whether that's getting an abortion or choosing the right birth control that makes the most sense for your body. And so having a center that provides compassionate care means that we shouldn't have to have 72-hour mandatory delay if we're centering our patients. And so it's a huge barrier, and it's an unnecessary policy in North Carolina. And like I said, the bias counseling requirement written by the state is not medically informed. It's junk science. It stigmatizes abortion, and we have to read them the statement and then let them know that it's not true and that their body is their choice. There are then just targeted regulations of abortion providers. And so they're literally called that. They're policies called trap schemes or trap policies that are specifically targeted to shut down abortion providers. So we have 14 centers, abortion centers in North Carolina. We used to have a lot more. Once these laws were introduced, they shut them down entirely. Some of them include, unnecessary reporting that people have to do at the state level. Every single ultrasound or ultrasounds are required before abortions. Those ultrasounds have to be submitted to state for record purposes. It's, in compliance with HIPAA, obviously, but just unnecessary. Like it takes, staff time and facility dollars to be able to do all of that. Then there are other things like about the building itself. It has to be a certain width. The hallways have to be a certain width. In case an ambulance, EMT team has to come through, further stigmatizing abortion and making it seem as if it's dangerous or scary, which it's not. Along with many other things around, the temperature in the building has to be a certain temperature. That doesn't make any sense, right? Things that just would not be required of other health centers or urgent cares. And they have shut down a lot of abortion clinics. Also, these regulations were first introduced in the state of Mississippi, right? So the same place where we saw the Dobbs case come out of. One of the reasons why Jackson's Women's Health Organization was the last abortion clinic in the state for over a decade is because of these laws. Because what it means is that we have to do our best to raise enough funds to retrofit buildings to be able to meet these medically unnecessary restrictions. It also means we have to own the building to be able to do that. A ban on advanced practice clinicians from providing abortions. So for example, even with medication abortion, you cannot go to your primary care physician and request medication abortion. You have to go to a specific abortion provider in order to do that. We also cannot train, nurse practitioners to provide abortions. They have to be MDs in order to provide abortions, medically unnecessary. And these laws don't exist in other states. There's also bans and restrictions on insurance coverage. So Medicaid, for example, will only cover an abortion if like the woman is like literally dying. You have to like prove death is imminent. And then additionally, a lot of insurances, and I encourage everyone to double check with their insurance, seriously. A lot of insurances, you have to physically like opt in to having abortion be covered. It's not automatically covered. And even if it is covered, you have to opt in. But so many people don't. And there's so many other restrictions depending on the type of insurance you have. Military insurances, a lot of them do not cover abortion care because they're funded by the federal government. And so many people are having to pay out of pocket for these costs. And so when we think about, who joins the military and the, the great coverage that, medicine coverage that military have, like these, it's actually not covered. Abortion is not covered. And then we have a ban. So just before this call, I got devastating news and my phone is blowing up as we speak. In 1881, there was a 20-week abortion ban. So 1881, someone do the math, 140 years ago, 130 years ago. And there was a ban on abortion after 20 weeks of pregnancy. In 2016, Planned Parenthood South Atlantic, we took them to court, the state to court. That was unconstitutional under Roe v. Wade. In 2019, the Federal Court of Appeals, Fourth Circuit Court of Appeals, put a permanent injunction on the law, meaning that it was permanently blocked by the federal court. and abortions were allowed up to the point of viability as defined by Roe in accordance with the Constitution, constitutional precedent, I should say. And so up until about 20 minutes ago, people were allowed to receive abortions up to about 24 weeks. And we just received word that the federal judge has overturned his own permanent injunction, and it went into effect immediately. So now that we do have a 20-week ban on abortions. This is really devastating news for a number of reasons. One, it's medically unnecessary. 20 weeks, 15 weeks, 6 weeks, they're all just completely arbitrary and made up. And two, the types of abortions that happen after 20 weeks are often due to serious risk of injury or death by the pregnant person, or there's a serious fetal anomaly, such as the fetus's brain isn't fully developed or their heart isn't fully developed, and they will not survive outside the womb. And so these types of abortions are often from wanted pregnancies, where there really just are very, very tough decisions that have to get made, but they're very serious health risks if they are not made. And for those that know about pregnancy or have been pregnant, there are a few different milestones of ultrasounds that happen. The 20-week is a milestone, and that is the week where these fetal anomalies and the fetal scan happens at 20 weeks, where the physician is able to determine if it is safe for the pregnant person to continue to have this pregnancy. And so by banning abortions after 20 weeks of pregnancy, it is not following medicine or science, and really just general health care, right? This 20 weeks is also part of the insurance coverage, right? It's a normal ultrasound that happens at this week. It's a milestone ultrasound. And so by banning abortions after 20 weeks, it's just doesn't even work, doesn't even make sense with our healthcare system and how it works and functions with pregnancy. So you all are the first to hear. I mean, it's been made public, but yeah, it was about 20 minutes ago that the ban officially went into effect. So much to do. Impact on people. It just almost goes without saying how this impacts people, but paying for abortion out of pocket, right, because of insurance issues, traveling long distances because all of these barriers that have shut down abortion providers, paying for gas, for lodging, paying for childcare, taking time off from work. There are so many delays in their abortion procedure, pushing them further into pregnancy. As we mentioned, the 72-hour waiting period, the influx of people coming in. And then also just the experience of protesters at clinics. There are, so many people who come to our clinics who just have to deal with the protesters. I mean, it's unthinkable that someone would be protesting outside of a health center. And, we also do so many other services at Planned Parenthood. And so someone could even just be coming in to get their IUD changed and they're being yelled at. And so, we have to work really hard to combat that stigma around abortion and make sure that our patients feel welcomed and have compassionate care. And so we have clinic greeters, which are incredibly important for us to make sure that, we walk them from their car to the entrance, and so that they know that they are welcome and they are loved, and whatever decision they make is the right decision for them. Oops, this is going to work. Here we go. So who has abortions? 1 in 4 women in the US have an abortion by the age of 45. We also know that, these statistics, this is 1 in 4 women. We do believe that includes trans and non-binary people as well. So it's incredibly common. It's an incredibly common procedure that happens, that 1 in 4 women in the US will experience at some point in their life. A number of folks are economically disadvantaged. The majority of people already have kids. 6 out of 10 people already have kids. And the majority of them are in their 20s, 30s, or 40s. So they're grown adults able to make the decisions about what's best for them, their health, their family. So I think there's a common misconception that, it's just a bunch of teenagers running around, having sex and wanting to get abortions, which if you do have sex and you do want to get an abortion, that's perfectly fine. That's the only way you can get an abortion, I guess, if you have sex and get pregnant. But the reality is that most people who get abortions already have kids, and they are grown women who are making the best decision for themselves. I also want to talk a little bit about how to talk about abortion. So I have a couple of slides here. There are so many misperceptions of what abortion is, and really in combating that, we encourage folks to just talk about their values. So we talk about abortion in regards to health, healthcare. We talk about abortion in regards to bodily autonomy, right? We talk about abortion in regards to freedom. And so having the power or freedom over one's body and life. Abortion is a personal decision. Every circumstance is different. It is not my place to tell someone else what to do. And so we can often get into the weeds about, Republicans or anti-abortion opponents. Oh, I'm so sorry, my cat just did that. Anti-abortion opponents will, get in the weeds about when is conception of life, right? And I'm like, that is not what we're talking about. We're talking about the fact that abortion is a personal decision and people should have the power and the freedom over their own body and life. That is what we're talking about. So I encourage people to really, you can take a screenshot of this, you can take notes of this, but really stick to the values of health, autonomy, and freedom whenever we talk about abortion. And then I have another slide here that's also a really great screenshot slide. This is just some harmful versus helpful language. And I'll just say now, every person's sort of the way they want to talk about abortion is different. Every community is different. But we really encourage folks to sort of try on this language on the right. So one of them that I'll point out, the top two, this idea of like pro-choice or pro-life. We actually know that about 40% of people don't identify with either label, right? It kind of creates this like false dichotomy of like, what is pro-choice and what is pro-life? When in actuality, this like, we don't really say the pro-life movement anymore. We say they're anti-abortion. That's what they are, right? They're anti-abortion. They're trying to close down abortion centers. They want to, put limits and restrictions on abortion. It is not about them being pro-life. That is their term. That is what they use, and that is inaccurate. So we really encourage folks to stop using, and you can still say you're pro-choice. That's perfectly fine. But we would encourage people to not think about this dichotomy in such a way, because so many people really don't agree with it, or I think fully even understand it. And so being direct and saying they're anti-abortion, that's what they are. Also saying the word abortion is really helpful. It's a stigmatized medical procedure that does not need to be stigmatized, which kind of goes into the women's healthcare or reproductive choice. Women's healthcare is just such a broad term, and we still see it all over the news. We see it in Congress. And it's not a bad term to use, but women's healthcare is so broad and women have a lot of healthcare needs. And so really just staying focused on, abortion access, abortion rights, or even like reproductive choice and abortion access. You can say both. But just saying the word abortion is really important to help destigmatize the word, and also just to be direct about specifically what you mean when you say women's health. And then choice and decision. So this one is kind of a tough one for folks, but we have moved away from saying the word choice in regards to the choice to have an abortion. Polling has shown us that people really resonate better with the word decision. Decision is less flippant. It makes it more, there was a thought process that went into, they made a decision. It's more definitive, versus choice could often be chicken or fish, make a choice. And so we encourage people to say the decision to have an abortion, she decided to have an abortion. When someone makes the decision to have an abortion, just using that word decision, it seems to resonate better with people and leaning more towards supporting abortion. The only other one I really mention is this heartbeat bills on the left. So that is, I don't ever say those words. The anti-abortion opponents like to sort of make up their own medical facts. It's all junk science. And they'll say that there's heartbeats bills, there's a heartbeat at 6 weeks. That's not true. There is not a heart at 6 weeks. There's fetal tones, which are different, but there is not a fully formed heart at 6 weeks. And they like to call them heartbeat bills, which makes people think that there's a full-grown baby at 6 weeks, and there's not. So they're all just bans on abortion. And so we really encourage folks not to even say those words on the left, those ones, the heartbeat bill specifically, but to really try on the words on the right and how we talk about abortion. And I lost my cursor. Here we go. So just a few things. One, vote. I know everyone on this call knows to vote, but it truly is incredibly important. Come what may, in 2023, we will be better off if we vote for people that really support abortion access. And I will drop in the chat the link to our website, which has all of our endorsed candidates. So we do endorsements of folks at the state level. I'll say that we're like very, very close to being fully done. There's a couple people that we haven't yet fully gone through the process with, but most of them are up there. Always volunteer to be a clinic escort. So in Chapel Hill, it's probably going to be the closest for y'all. And we always need volunteers to help, go out there. We're increasing our clinic hours and increasing the number of days that we provide abortions. And so that just means we always need more volunteers. We're also going to be, I'll put a link in the chat as well in a minute about electoral volunteers. So there's a number of candidates in Wake County that we are going to be actively canvassing for and working to help elect. So if you're interested in doing some of that candidate work, please sign up. And we're going to be having a Wake County endorsed Planned Parenthood Votes South Atlantic endorsed candidate forum as well in September. And so it's a great opportunity to come hear from our Wake County folks. Wake County is just such an important area for us, county for us. There are lots of top districts. So we're going to be working hard to get some of those folks elected. We have an event coming up on August 28th in Durham. It's going to be pretty fun. It's kind of like a concert we're putting on. We got a couple bands and a drag show, which should be really cool. And we're going to have a number of folks coming out and tabling. If y'all are interested in that, also let me know, interested in tabling. I'll connect you with our person that does that. And then we always need people to share their story. So talking about your own abortion story with your family, with your friends is incredibly important. And so I encourage you, if you feel so inclined, you can click on the links in a couple minutes that I'm going to share, and you can share your story with us. I'll go ahead and stop sharing my slide. Are there any questions?
Jillian, this is Amy. I have a question. I don't see anything in the chat, but I know that you've talked about this in the past, about how many millions of dollars the state budget gives to these crisis pregnancy centers that aren't medical centers. They're really anti-abortion centers.
Yeah, yes, they're anti-abortion centers. They are not staffed by any medical providers. They're all volunteers. And they get, I want to say, I think they're up to $17 million of state tax dollars. They seem to just get more every single year. And they will pop up right across the street from an abortion provider. They intimidate our patients. They lie to them. They say that they have free ultrasounds. Their ultrasounds are done by a volunteer in scrubs. They dress up in scrubs. They are not trained medical providers to give ultrasounds. And they will lie to our patients about the number of weeks they are, that they're not eligible for abortions. And then they'll lie on them to the media as well. You know, the media will call us and say, well, we spoke with so-and-so, and they said that they refer to you if anyone wants an abortion. No, they do not. That is not true. They do not do that. They, you know, and force people into pregnancies if they do not even want them. And we have a lot of patients that get roped in to those clinics, and I don't even like to call them clinics, those centers, and are traumatized from them. There's just, I can go on and on. I mean, they just do horrible things, and they're completely funded by our state tax dollars. And I'm not even sure what they use the money for besides the building, because they're all volunteers. So, but let me see. Yeah, so thanks, Mary. Are you experiencing an increase in public activation that you think will translate into increase in voter turnout? So I can just say that, you know, from what happened in Kansas, right, was incredibly exciting, where Kansas voted to protect abortion access. And the people that voted to protect abortion access were Republicans and independents, as well as Democrats. And that just really goes to show that all these polling that's happening nationwide, saying that 80% of Americans believe in protecting abortion access, is coming true. And we knew that, and we do believe that abortion is a winning issue. And I can say that in communications with our candidates, they get questions about abortion when they go door to door. People are asking them about this all over the state, in urban areas, in rural areas. A number of our candidates do polling, and they come back and they say abortion is the number one issue I'm asked about. So absolutely, I think it's something that, you know, especially as we saw in Kansas, I think it's something that is very motivating for people to get out to the polls. I think that a lot of people in this state had no idea we had an election until Roe v. Wade was overturned, and now everyone knows. So we are absolutely doing everything we can to continue to increase that public awareness and continue to make sure people know how critical this election is and how much is really riding on the people that we elect. And we hope it will pay off. Vicky asks, I have raised the issue of business choosing not to locate in states that have banned abortions, thinking that this approach would resonate more with the members of our General Assembly. Yeah, I think so too. We are definitely working on a strategy to better engage the business folks. But I think, just like, I think we can compare it to HB2, where even in Indiana, right? We saw in Indiana, they just passed the total ban, and there are businesses pulling out of Indiana right now. And I hope that our GOP leaders are watching the news just like we are, and they're seeing exactly what's happening, and they're having deja vu coming up to them, thinking about what would happen if they passed the bill. And Apple pulled out from their, big expansion in the triangle. What would that look like? So definitely hopeful, and we're excited to see so many businesses that have come out to be in support of abortion rights as well. We've never seen this before, but now businesses are saying that they want to help pay for the costs of transportation and lodging, which is a really great thing. Yeah, exactly, Vicki. Right. So big employers in Indiana are saying, okay, we'll go someplace else. And hopefully we can say, come to North Carolina, right? Hopefully we can say, yeah, come here, we'll protect abortion. The state health plan does not cover abortions that I'm aware of. It might be the case of let me see, the state health plan. Yeah, no, it doesn't cover abortions. And yeah, I know, and they use our tax dollars for anti-abortion clinics, which they didn't, when they deny people from getting abortions. Yeah, it's definitely crazy to see that happening. And knowing that, the budget process in the General Assembly really is just, it's not a participatory budgeting process where people are really able to influence the budget. And this year we saw what was called a conference style budgeting process, which basically means that the Republican leadership decided everything behind closed doors, and then they just introduced it to the legislatures, and they weren't allowed to change anything. And that is how the budget is passed sometimes in North Carolina.
So Jillian, I'm going to put this in the chat. I know that you started talking about Wake County and how important that is, but I recently, I think it actually was in June, read a WRAL article about how there's several races in North Carolina that's really going to put abortion access on the ballot. So I'm going to go ahead and send that to everybody, and the link. It's the two state Supreme Court races, the US Senate race, and then the Senate and the House races. And I think one of these is actually in Wake.
Yeah, so District 17, that's in Wake County. Oh wait, yeah, that's Senate race county. District 18, that I think is in New Hanover County.
Yeah, the WRL link shows that it's not Orange or Durham or Chatham counties, but there are some important races in our state that if they're turned, then the ability for the governor to veto and keep further restrictions is going to be very difficult, if not impossible.
Yeah, it's incredibly important that we win these races. It is. And I just posted our link of endorsed candidates. And then I'll also post our volunteer link. Oops, let me put this here. And if you're interested in getting email updates around the campaign work that we're doing for candidates, or coming to a candidate forum in Wake County, I encourage you to sign up for that link to get emails from us about that.
So Mary asks, is there a list of companies supporting anti-abortion candidates and bills?
I don't have that list. There might possibly be a group out there that does that. I know there's a lot of tracking around, finances, campaign finance things. But no, that's not something that we have put together. Any other questions? Vicky, are you trying to say something?
It looks like Ariane put something in there about the work that the Carolina Abortion Fund is doing.
Yes, you can absolutely donate to the Carolina Abortion Fund. We work really closely with them. They get a ton of donations, and all of their money has like gone out the door. There's so many people in need, and they work both in North Carolina and South Carolina to help cover the costs of what it means to get an abortion. So we talk about the travel costs, the lodging costs, the childcare costs, the lost wages at work. They work with patients to fund all of those needs, and we work really closely with them. Vicky, did you have something?
I was just saying, we're all with you.
Thank you.
We're all sharing and doing the best we can to, as individuals, not as the league. I don't speak for the league, but we're all, and that is one of our issues though,
Yeah.
as the league. But I'm doing everything I can via social media.
Well, we appreciate it. It truly does take everyone, just continuing to talk about this issue and encouraging people to go out and vote. I mean, it's just, we just really can't let up on it. The anti-abortion opponents had a 50-year plan. They're now seeing the fruits of their fruition, and we have to do everything we can to prevent that from happening in North Carolina. And also we have to be prepared to work 50 more years to get it reversed. So
Yeah.
the fight continues. Yes.
I think you can find out which corporations provide money for various candidates by getting their campaign finance report from the State Board of Elections.
Yeah, you're right. Yeah. I mean, it's all public knowledge, as long as you know how to work the system. Well, thank you all so much for having me tonight. And I appreciate all of the work that you all are all doing. And I really hope to see you out knocking on doors together, or at one of our events coming up.
Ariane, do you have your hand raised?
No, just raised, just.
Clapping.
Oh, they're clapping. Yes, thank you. Thank you so much for joining us, Jillian.
Thank you.
And taking the time. And there's a small group of us that have been sharing articles and trying to track what's happening and throughout the states. And I'm happy to add anyone to that list as we comb through the news and try to find out what's happening, because so much has changed since this ruling, and it's not going to stop changing. I think it's just going to be continuous change for access.
Unless we stop it.
Yeah. And knowledge is and teaching is one of the big things for the league. That's one reason why we wanted you to come. And we did vote in our annual ODC meeting to make sure that we supported whatever the state was doing for ERA and reproductive rights. So
Great.
We believe that both are very, very important.
Yeah, definitely. Yeah, the ERA, man. I don't know. It's not that hard.
I think if we had the ERA, that abortion restrictions would be much harder.
Yeah.
I've started wondering if that's why the ERA had a time limit and why it didn't pass.
Hmm.
You
that-
probably aren't wrong. I believe all conspiracies at this point.
If it involves women.
Yeah, I'm like, yeah, it's probably true. All right, y'all. Well, thank you so much.
Thank you. Keep up the
and-
good work.
Yes, I appreciate it all. And I'll see you soon, hopefully.
Okay. Bye-bye.
Bye-bye.
Take care. Thank you so much.